Welcome, I'm Joaquin Vespignani, Associate Professor of Economics at Tasmanian School of Business and Economics, University of Tasmania, and co-director of the COVID-19 and the Macroeconomic Research Program at CAMA with Professor René Fry McGibbons. We are excited to hear a presentation from Enrique Martinez Garcia on checking the path toward recovery from the COVID-19 response. Enrique Martinez Garcia is a senior research economist and policy advisor in the research department at the Federal Reserve Bank of Dallas. Martinez Garcia holds a PhD in economics from the University of Wisconsin-Madison and an MA in economics from the University of Pennsylvania and BA in economics from the University of Alicante in Spain. His main research interests lie in the field of international macroeconomics and finance, monetary economics, and applied econometrics. He has briefed the Federal Reserve Bank of Dallas president and the FOMC on these topics and has published extensively in scholarly peer-reviewed journals and in the Federal Reserve Bank publication. Martinez Garcia spent time at the Bank of England and the University of Wisconsin-Madison Center for the World Affairs and Global Economy, and has taught economics at the University of Alicante, at Southern Methodist University, and at the University of Texas at Austin. He currently serves as a co-director of the International Housing Observatory and the lead researcher at the Federal Reserve Bank of Dallas for the International House Price Dataset, and for the database of global economic indicators. We will hear from Enrique for about 40 minutes, and then we will open up the audience for discussion. If you would like to ask questions, please ask questions by using the Q&A function. You can type your question into the Q&A box. If you would like to ask your question via your microphone, please use the raise your hand function on Zoom, and I will allow you to turn on your microphone so that you can pose the question directly to the panel. If you would like to ask your question on video, raise your hand and also send me a private chat message to let me know that you would like to turn your camera on. Before we begin, I would like to let you know that we are recording this session, which will be available on CAMA webpage after the event. Now I pass to Enrique, and we hear your presentation, Enrique.
Joaquin, let me, while I share the screen with the presentation, let me thank you and the organizers of this research program on COVID-19 for inviting me, and in particular for inviting me to present this paper with my co-author Finn Kidland from UC Santa Barbara. This is the first time that we presented it, so I think it will be a great opportunity to get some feedback on what is in part still an ongoing research project. So I'll, without further ado, let me give you the usual disclaimer that I'm sure you've heard from many others that work for the Federal Reserve, that this paper and my presentation certainly represents our views, our current views anyway, but not those of anybody else affiliated with the Federal Reserve Bank of Dallas or the Federal Reserve System. And let's dig into the paper. So I think it would be a surprise to no one by now, unless you have not been paying attention to the news at all over the past several months, that the global health crisis that we've been involved with and battling with has meant the implementation of a wide range of policy actions and measures that are fairly unprecedented, at least in the post-World War II period and at a global scale. Measures that are aimed at containing, but mostly mitigating and to a large extent with the aim or the hope of eventually suppressing the pandemic. Now, the goal, the objective of these measures and the theme of many of the actions that governments around the world have been taken gradually since the beginning of, or not so gradually, quite abruptly in some cases, since the beginning of 2020, is that of one of the most popular phrases of the last few months, flattening the curve. That is trying to slow down the spread of the pandemic, trying to bring down the basic reproduction rate to less than 1 in order to delay the peak and reduce the burden that this might have on the healthcare system, with the hope of lowering cases and saving lives. Now, all of that is well known and understood, but to us, when we were thinking about the economic consequences that this global health crisis may have for the economy, or the aggregate effects that it might have, two things stood out. First is that a lot of the measures, certainly very early on, that were adopted by government, had a preventive character. There were recommendations like wash your hands, keep a certain distance with others, and so on. But many of the restrictions that were imposed, that were eventually put in place by governments, had a fundamental disruptive character. They disrupted conventional or usual business operations, and they were a disruption in particular for mobility and for labor mobility more specifically. So that's point number one. Point number two is much of the literature, the macro literature and the research that has focused since the beginning of the year on trying to understand the economic consequences of the pandemic, try to explore both theoretically but also empirically what would be the causes of this pandemic, not so much the causes, but how to interpret the nature of the recession associated with it, or they would have to do with what are the mechanisms that would explain the impact that the recession and the response would have on the macroeconomy and on the path towards recovery, as well as the policy actions, of course, that could be deployed to try to firm up the recovery. One thing that we thought was missing in all of this debate was how are private agents themselves interpreting or anticipating the recovery to look like. What it is expected, what do they expect? And that's what made us particularly interested in the question of how private agent expectations have shaped up since the beginning of the year, and to what extent we can relate some of those changes in private agent expectations to the same actions that policymakers implemented in order to slow down the spread of the pandemic. Now, ideally, we would have expectations about households, expectations from firms, and so on. What we have is something somewhat different with unique properties or unique features that we like. We have daily forecasts, and by daily I really mean updates on a business day, each business day, from professional forecasters across a sample of up to 32 different countries. I'll talk a little bit more about the data in a second. And we also have two measures of the impact that the policy has. One is a measure of the real-time implementation of those policy responses and along certain dimensions, which I will get into in a second, based on data collected by researchers at Oxford University. But we also have at least an indicator or a signal of mobility from Google that we believe contains potentially useful information about behavioral changes. And with that data, we hope to, or the aim of the paper is to analyze the extent to which those policy restrictions and the behavioral changes of individuals in response to the pandemic, to what extent they have contributed to shape and to shift the expectations of private agents about both economic activity as well as inflation. And for this analysis, we use a linear mixed effects model, which I will discuss in a second. Now, if I had to summarize sort of the key findings or some of the takeaways, probably is a better word, so far of what we find in the data, I would probably summarize it in these 4 bullet points. And let me give it to you straight away. First, that we find evidence that indeed more stringent physical distancing measures tend to correlate with lower growth rate in recorded deaths attributed to COVID-19. I'll get into the discussion of this data in particular, but deaths attributed to COVID-19 would be our signal of the extent of the epidemic within a country. And as I said, I'll talk about that in a second. Now, that in itself is probably not surprising. There is quite a bit of the studies that using different data and different techniques have come to similar conclusions. What we find in this paper is that these professional forecasters, their expectations for near-term global growth, and in particular for the medium term over the next 2 years, have shifted dramatically. Particularly, it seems like the tipping point was around March 9th, which seems like ages ago, but it was not that long ago. It was at the time when the Italian Prime Minister declared a nationwide lockdown in the country. That seems to have dramatically changed the views, and pretty quickly indeed, the views of professional forecasters about the outlook for the pandemic, not only in Italy, but around the world. And we find that the recovery appears to be checkmark shaped. I'll talk a little bit about what that means, but it's not unlike what the IMF would tell you if you've been looking at the World Economic Outlooks in reports of April and the most recent one. And that we can relate to some extent these changes in forecasts to those behavioral changes that relate to individual mobility and to the stringency of the physical distancing policy measures implemented in the first quarter of the year. The third point is that, interestingly, at least up to mid-April, which is when our current data set ends, there is very modest changes in the expectations of headline inflation and therefore on the path of headline CPI across a sample of countries. And very little of it can be attributed, if any, to these behavioral changes or to stringent physical distancing policies. Finally, the last point I would like to make and that I will be talking about is more of an argument. And we find that the extent to which macro expectations indeed reflect some of these behavioral changes and stringent physical policies, and the fact that the shape of the recovery is a lot more gradual than anticipated, may have to do ultimately with the constraints on labor and possibly with the impact that some of these restrictions may have on productivity and labor arrangements and so on, which I'll talk at the end of my presentation. In terms of what to expect, I talked a little bit about the introduction, motivation of our research, as well as some of what we see as our key findings or contributions thus far. I'll talk a little bit about what the data is in more detail and the methodology that we use to assess our findings. And then I'll talk about those empirical findings in terms of health outcomes, as well as in terms of the impact on the expected macro effects over the next couple of years. And after that, I'll conclude. So what data do we have? I think I already mentioned this. We have 32 countries in the sample, advanced and emerging economies, including the US, representing something like about 81% of world output in GDP terms as of 2019, based on IMF data. The full sample period that we have data for at daily frequency, although with the caveat that when we talk about daily, we really refer to business days only, goes from January 1st, 2020 till April 13, 2020. If you want to think about this, and this might become more relevant at the end of my discussion of the paper, you can think of this as what the views of private agents would look like before much was known about the pandemic, and what we knew right before everybody, the IMF included, was talking about the dire consequences of what is already being called as the great lockdown recession. So that's the sample that we are going to be working with. The data that we have. In order to measure or to obtain a quantitative measure of the intensity of the stringency of the response that the governments have put in place to try to flatten the curve, or with the aim of flattening the curve, we are going to rely on the real-time indicators of researchers from Oxford University. They have put together a real-time data across a large number of countries, including those that we are going to be looking at, for which we have expectations data, on a number of variables. And they come up with a way of scoring each one of those dimensions on a daily basis in real time, and to produce an aggregate measure. That's going to be our measure of the intensity of the response, or I will refer often to it as the stringency of the response, since the authors call it their indicator, the stringency index. And this includes things like school closings, workplace closings, canceled public events, closed public transport, and so on, most of which are dimensions that impede in one dimension or another the gathering of large crowds or the mobility of individuals. And therefore they have potentially an impact on a behavioral impact on the relationships of individuals that is in line with what we are interested in investigating. We also have data from a related database, also from Oxford University, on officially recorded deaths attributed to COVID-19. And the growth rate in this officially recorded number of deaths is going to be a signal about the evolution of the pandemic. And I'll talk a little bit more about health outcomes and why do we choose this variable when I talk about the specification of the model. The other two variables that we have in our database that we are going to be exploiting are the community mobility reports. This is publicly available. Data is available, is data that is available only from February 15, 2020. And at the time we did our analysis, it went up to April 11th. So when we include community mobility data, this is going to restrict our sample to start at the beginning, at the middle of March. It's also going to exclude China and Russia, for which Google does not report data. So what is this data about? First of all, this is data that ultimately, or at least that's my understanding, is based on information that Google collects every time you and I tell Google Maps that we allowed to know our location. Now that information in itself is private, and even the aggregates that we are using have only been made public in the midst of the pandemic for the very same reason that motivated our paper, because it was an interesting and relevant measure that could potentially tell us something about the spread of the pandemic, or as in our case, the impact on economic activity expectations. Which is ultimately what we are going to be exploring. Now, it's measured as a percentage change in visits relative to a baseline within a geographic area, and potentially even by type of location, relative to the median number of visits that you were expecting on the 5-week period from January 3rd till February 6th of 2020, so at the beginning of the year. 2020, and it has very different aggregates of locations. The two ones, or the three ones that are going to be more significant for our analysis are residential locations, workplace, and transit stations. Finally, we have access to, and this one is not publicly available, that is proprietary data, but we have access to a continuous economic survey of a panel of forecasters for each one of the 32 countries in our sample. This panel of forecasters supports their updates on a daily basis, each business day, on quarterly real GDP growth, as well as quarterly headline inflation. So we have both variables to look at. And the source for this is consensus forecasts. Up to mid-February, we had up to 6 forecasting horizons. It would go from first quarter 2020 to the second quarter of 2021. Starting in February 17, however, we have complete data for each quarter of 2020 and each quarter of 2021. And we are going to explore all these forecasting quarters in our analysis. Now that's the data. What's the broad type of, and in some ways the simplest analysis that we could perform to try to find to what extent either the mobility indicators or the stringency index from Oxford University have any relation with the shift in expectations, or for that matter, with health outcomes as related to the growth rate in reported deaths attributed to COVID-19. Well, in order to analyze that question, one simple first pass thing that we could do is to run a simple linear regression model. What we propose here is a slight variation on that idea, a linear mixed effects models that allows us to introduce some random and fixed effect variation in the specification. And what this slide that you are seeing now shows is precisely what the specification would look like. Y refers to the number of, to the observed variables that we wish to predict, be it health outcome variables or expectations, for which there is a sample size, a quite extensive sample size that covers the first quarter of 2020, plus the beginning of the second quarter. One of the things in which, in fact, we are working now that might merit revising and revisiting some of the empirical findings that we present today is precisely that we now have data up to July 6, 2020. But obviously, I don't have access to that right now to show you the results. I don't have access to the results right now to share them with you. Now, the number of observations will represent the sample size, the time series dimension, times the number of groups in the model. And that will involve the number of countries. And in the case of the expectations variable, these groups or this class, using the terminology in the literature, will be per country and per forecasting horizon. X refers to the predictors, with beta being the corresponding coefficients. Z is the matrix of random effects. U would be the random effect coefficients. Epsilon, in the notation of this model, is the residuals, which are assumed to be Gaussian. Okay. Some additional assumptions here that would simplify the estimation, or that would make it feasible to estimate things, to estimate this model. Now, the type of exercise that we are going to be looking at is one where the randomness is associated with the coefficients in some of the predictors that our model includes. And that randomness is modeled explicitly by imposing a multivariate log normal distribution on the random effects coefficients U. That's one of the key assumptions of the estimation strategy that we are going to follow. We also have to specify the structure of the variance covariance matrix for the residuals in the specification. And given all of that and the assumption of Gaussianity, then the conditional distribution of outcomes is what you see in the last equation at the bottom of the slide. So by maximum likelihood, you can potentially estimate these parameters by estimating beta, as well as, rather than estimating the random coefficient per se, you are estimating the variance covariance matrix for that distribution, normal distribution that we have attributed to those coefficients. Now, this is a way of introducing structure that helps us with the estimation, but why are we doing this? And I think this chart might actually help get a sense of what we are aiming for and working with, why we are working with these linear mixed effects specifications with random effects. If you were to do a full regression across the data in all the 4 countries that you see in this particular illustration in the slide, then you would find something like the dash black line that you see in the graph, and a particular slope and intercept associated with it. Now, if you look at the data in greater detail, there is a lot of variation within country, but there is also a great deal of variation across countries that might be confounded by a full regression. By allowing some of this randomness, we allow potentially the slopes and the intercepts, at least the slopes of some of the regressors, and the intercepts on these regressions to vary over time. And if we did that, the illustration I provided you here shows that what you get is a somewhat different, not somewhat, significantly different picture about what's going on in the data. So that's sort of the data and the strategy. And now we dig into what is it that we actually do to model health outcomes, and subsequently I'll talk about to model expectations. Now, the model that I'm presenting here is the collapsed version of what the model would look like in our baseline specification. Much more complex specifications could be considered. In particular, this particular specification has just one regressor, this stringency measure that we've talked about from Oxford University, but it doesn't say anything about mobility. And that is because when we explore the alternative specifications on the data, there would seem to be very little gain from adding additional regressors, in particular from adding mobility as our regressor, I should say. And the other thing that we should point out is that in this case, we are allowing for random variation in the intercept. We've also considered the case that there would be random variation in the slope associated with the stringency indicator, but again, the data did not seem to favor that particular specification. And what is it that we take as our health outcome variable? Now, there are many difficulties associated with trying to come up with a strong signal in the data, especially during the sample period that we've been looking at, when many countries were seeing the beginning of their own outbreak within our sample. In the end, we chose to look at the growth rate in the number of reported deaths attributed to COVID-19 after an incubation period of 2 weeks. So the idea would be here that if stringency measures were being effective, then you should expect that to have an effect by lowering the growth rate at which deaths are being recorded officially. At least that's the expectation. And we thought at the time that would be probably a stronger signal, given that although there are differences in the way this data is recorded across countries that would matter, there were even more significant differences both across country and even across time in other measures like testing number of positives, for instance, or related variables, because it very much depends on the testing capability and the testing policies that each country have in place. Now, having said that, Table 1 records our key findings here. We have Model 1 that includes only intercepts in the specification, but there is random variation associated with it. And Model 2 is the preferred one, or the baseline one that we've been looking at and that I discussed in the previous slide. And it tells you what happens when you add stringency as an indicator. Now, if you look at what's recorded here, the intra-class correlation coefficient, in some respects, it's telling you a little bit about how well we do in capturing the variability that exists across, in this case, countries. That's the sort of grouping underlying the data for this exercise. And there are modest improvements. There are also modest improvements if you look at pseudo R squares as a measure of goodness of fit of the regressor itself. But one of the things that I think we truth in advertisement should recognize is that first, this is a data set that is potentially noisy, but second, most importantly, there are other potential sources of variability that remain unmodeled. So, so these measures of stringency have contributed to some extent, but in short, they are not necessarily the full story. Now, if we look at this, we could highlight, if we look at this data and these empirical findings in a little bit more detail, we could highlight three salient points, or I would highlight at least three salient points. One is that it's interesting that in terms of the impact it has on the growth rate on reported deaths, the actual behavioral changes in mobility are less important than it is the policy stringency measures. In other words, it would seem like what's important is that you are preventing large crowds in environments like workplaces, than the fact that mobility in workplaces has declined significantly. So that's step number one. It's already something I mentioned when I indicated that our preferred specification here was one where it would seem sufficient to account for policy stringency, and it would not seem to add much value to include any measures of mobility. Now, the caveat on all of this is that a great deal of uncertainty remains. What this shows is that for those 3.5 months at the beginning of the sample, there was indeed a correlation between the stringency of the response and how the pandemic seemed to evolve. But that doesn't tell us a lot of things that would be relevant, like what are the measures that were more effective in slowing down the progression of COVID-19, because this might be relevant when we think about reopening the economy safely while preventing a new wave of the pandemic. Now, there are other things that will potentially factor in that we know little about, and in particular, one of them is the degree of immunity of the population and whether we are going to get a vaccine, or when we are going to get a vaccine that could provide some degree of population immunity. And even if the pandemic itself might become something like endemic, like we will have a COVID-19 season, like we have a flu season, things like that seriously play a role on how we think and evaluate these types of policies going forward. In other words, past experience does not necessarily provide us with all we would need to navigate in the coming months, the situation in the coming months. Finally, the negative relation between health outcomes and the degree of stringency of the government response is significant. That's already something I've argued in presenting the results in the previous table. But there is a lot of country characteristics and cross-sectional variation that we are missing admittedly. And part of this might have to do with things like differences in urban density that might matter for the propagation of the pandemic, demographics, etc., etc. And also the timing of the outbreak, because obviously there is, perhaps not so obviously, but there is the expectation that there is some learning that when you saw things get bad in Italy, for instance, other European countries less affected started to learn and acted earlier. That may have had also an impact on the initial conditions on which eventually the outbreak would take place. And to try to illustrate the marginal effects, I just wanted to share with you this plot of what the predicted impact for the sort of the average country would have been, depending or as a function of the government response. That's what you see, the government response in the horizontal axis, 0 being no response at all, and 10 as strong as it gets, according to the Oxford University's measure. And not surprisingly, this sort of just illustrates what we were talking about, that the stronger the response tends to be associated with a lower predicted daily percentage change in the number of reported deaths due to COVID-19. And again, remember that there is still a great deal of variation across countries on this, but on average, that have been the expectation. When modeling macro expectations, we have a richer and somewhat more complex model as our baseline here. But in essence, it's essentially the same story that I described in talking about modeling health outcomes. You have stringency as one of your predictors, and now we are going to include some of the measures of mobility as well. And importantly, we find that is quite significant that we also include the interaction between stringency and mobility. It would seem that the efficacy of stringency might be stronger, for instance, when the behavior of the individuals is consistent with the policy and leads them to a decline, to record significant declines in the mobility in places like workplaces, and an increase in residential movement or visits. Now, the specification is a little bit more complex, but at the end of the day, it's what this model, or the model in this slide, suggests is that in our baseline, we are going to allow for random variation to occur both on the intercept as well as on the slope on the stringency. That seems to be the specification that is most favored by the data, at least according to the sample that we have. And in doing so, we allow for random variation both across countries and within country across forecasting horizon. Remember that when I talked about the variables that we wanted to predict with this specification, in talking about the macro expectations that we get from consensus economics, we were going to try to exploit all the horizons for which we have data. So the YT includes a subindex for J, the country, but also for H, the forecasting horizon. And the particular variable that we are going to be talking about is the deviation between the implied level on economic activity or on the headline CPI relative to the baseline of 2019 Q4 set equal to 100. So in other words, is when you see some of the results that that illustrates the impact of stringency and mobility later on, keep in mind that at different forecasting horizons, we are looking at where would the level of that variable be if we were comparing us against 2019 Q4, which is naturally the quarter before, right before the beginning of the outbreak of the pandemic, or at least of the known outbreak of the pandemic. I think that's all I want to say in terms of the specification at this point. My apologies, I was not able to fit the table of the results in a better way than this. I'll talk a little bit through the numbers, and hopefully I'll be happy to share this these slides with anybody that is interested. So hopefully you can look at the numbers more closely, if not directly from the paper. In here, we report 3 columns indicating 3 different types of models. The same 2 types of models that we looked for health outcomes, one that has intercepts only, but random variation in the intercept, the other one that has only stringency as a predictor, but random variation in the intercept as well as on the slope and stringency, and the third one where we add mobility as an interaction between mobility and the stringency index as predictors. Now, what we see when we look at these data is that a lot of these interaction terms are actually statistically significant in the specification, and that the baseline model, which is the one that appears to the right of the table, model N3, the last one and the longest one too, performs better. We capture better a lot of the by country variability, and also part of the variability across forecasting horizons within country. And the model also, the regressors also seem to add a value in terms of helping us forecast the expected path on real GDP. That's sort of the summary of what these numbers are telling us in a nutshell. Now, Table 3 has exactly the same 3 specifications, but a quite different reading, or at least our interpretation is very different. Although some of these coefficients, although some of the coefficients and the interactions and the predictors appear as well to be statistically significant in the baseline specification, the one to the right of the table, the fact of the matter is there is very little that we gain in terms of explaining the random variation by country or within country by forecast, and there is very little that these predictors seem to tell us, to be able to tell us about the expected path of the of headline CPI. And this has to do, I believe, with the fact that if you look at the data, by and large, what we actually observe across many countries is that there might be modest declines in the expected inflation earlier in 2020, but basically the expectations for the rest of the year seem to be back to what was, and for 2021 in particular, seem to be back to where they were at the beginning of the year, on January 1st, before the pandemic was known and became the global health crisis that has become. Part of this might have to do with the fact that central banks have, in many of these countries, are following a sort of implicit or explicit flexible inflation targeting approach, and that seems to have been a credible commitment, at least up to mid-April. So one of the things that we are most interested in analyzing the data, the more recent data up to July 6th, is precisely to look at whether those expectations have eroded. In fact, if you look at the actual path implied by the forecast, at least up to, as I said, the beginning of April, you would see that the path on average would look like a very small or modest downward shift. But that's it. It's like it's very much reminiscent of the let bygones be bygones that you would come to expect from an inflation targeter. Now, effects on the macro outlook. I think I've talked a little bit about many of these things, so I'm going to try to speed up, among other things, to stay on time as well. But let me hit some of the highlights here, nonetheless. So The evidence on mobility in the workplace, in particular, is the one that seems to be most relevant when we are talking about the potential impact or the effect that we identify or that we detect in the data when trying to, when we relate these regressors to our measures of the expected path for real GDP across our sample of countries. And in some respects, you would expect that. You would expect that a lot of these measures that were in place, and even the behavior of agents by going away from their usual workplaces, have or may have had a disruption to business as usual and to the operations of businesses, and also to the way work itself takes place. There are significant differences that might be worth mentioning. Among them, some of them might have to do with the fact that there is also a great deal of variation across countries. And you could say we have the data for this even within countries on the degree to which work from home arrangements are even possible, for instance, as a substitute, and the impact that this might have. But this impact that we observe in the data seems to be long-lasting. In other words, what we observe in the evidence is that, at least on average, we would not expect the economy to go back to the level of output that we were predicting at the beginning of the year over this two-year forecasting horizon that ends in the fourth quarter of 2021. So part of this might have to do with the fact that if these policies, if this policy response had been a significant constraint in the short term on labor, maybe the expectation is that the unwinding of those constraints is going to be gradual. It's going to take time for businesses to either return to normal or find alternative arrangements that will be sustainable over longer periods of time, and this might have an impact. Another reason for concern, at least in our view, is that the longer these disruptions remain in place, we would think the higher the chances are that there will be a loss of human capital, that bankruptcies and liquidation will lead to the breakdown of matches between workers and firms that were productive and that would have to be reallocated, and there are costs associated with that, attendant costs associated with that, and that there may be a breakdown in other types of business arrangements between workers and businesses, but also between businesses and customers that could contribute to, among other things, a slowdown in productivity that also make it a lot slower for these economies to recover over the next 2 years. Now, the other point that I would like to make about this is that what we don't say at this point, and there is a great deal of limitation on what we've been able to do with the data and what I've been able to show you so far, is whether we actually could have done any better. One would think that more targeted and less disruptive measures might have had a similar effect, but that's an open question. There is also another dimension that it's missing in our empirical analysis, that and for lack of data, and for lack of recognition, which is to the extent that hygiene and preventive measures that have been advocated would have served to cushion the blow without having to impose some of the more restrictive measures that that potentially could have been more disruptive to economic activity, and whether all of these would have had similar or comparable effects on the progression and the impact of the pandemic. And the evidence, the final point is that the evidence on mobility in transit is actually interesting. There's very little that we actually get from the regressors that we investigate in this paper that would help predict the expected path of headline CPI. And one variable that seems to have some role at least is precisely mobility in transit stations. And I think that when we think about disruptions to businesses and labor, we also have to think that one of the important disruptions that some of these measures may have had that potentially could have led businesses to try to compete through price cuts to some extent is the fact that with limited mobility and limited mobility through transit stations, there is also fewer households or fewer individuals that are going to the traditional stores, and more individuals that are doing their shopping, either postponing it altogether for a time and saving, or making it online through online platforms like Amazon and so on. So these are interesting features, but as I said, the overall impact that we get is very limited in explaining the expected path of inflation or of CPI. Now, I'm going to show you two, and we are getting close to the end of the presentation. I promise. I want to show you a couple of illustrations of the effect that we are getting on economic activity as well as on CPI inflation. These two charts, these two subplots, refer to the model where we are aiming to forecast the expected real GDP path. And the plot to your right tells you what would happen depending on whether mobility in workplaces is high or low. What we would be predicting if mobility in workplaces was high or low. Low in here means one standard deviation away from the mean in the direction of less mobility than the average. High would be the opposite. And as you can see, within each plot, you have two parts for each the low and the high cases. In the background, the assumption is also that all other regressors are kept at their grand means. And we can say the same about the plot to your left that looks at the difference between high and low policy stringency. Again, measures one standard deviation away from the mean. Long story short is the path of the recovery looks somewhat like a check mark to us. There is a deep recession that would be expected for countries that had experienced or had to implement what we describe as high policy stringency, or that had seen low mobility in workplaces. The recovery, at least with the data that we had at mid-April, would not take a hold until the fourth quarter of 2020, and by 2021 we would still be at least 1 percentage points below in each one of the two scenarios that I'm considering here. Then if policy stringency was low and mobility in workplaces was higher and closer to the pre-crisis normal. Now, that's what we see for for our model on the expected real GDP, path. Now think about exactly the same sort of logic, but applied to the data or the model on CPI inflation. Basically, there is very little difference, and definitely it's not statistically significant, that can be attributed to either mobility in transit stations or the policy stringency, which comes to reiterate the point that I made before, that whatever it is that is contributing to the declines, to the modest declines in expectations about inflation early on in 2020 among many of these countries, does not seem to have much to do. In specific countries, it might have a role, but it doesn't seem to have much to do on average with the path of inflation over the next 2 years. Finally, as a way of heading into my concluding remarks, I wanted to show you, to step a little bit away from the evidence that is presented in the paper and share with you this chart. I think it's interesting in several dimensions, and I'll try to argue why. This chart shows what the evolution of forecasts with these professional forecasters has been like when we look at economic activity in annual terms. And I mean, here we have derived the implied path for GDP for 2020 and 2021 based on the January 8th, 2020 World Economic Outlook update from the IMF, on June 9th, January 9th, excuse me. That's the solid red line, and the dashed red line is the values in recorded in the April 14 release of the World Economic Outlook. Now the dark or black line, I should say, represents private forecasters. The solid line is almost a match with the IMF forecast. There was very little disagreement at the beginning of the year between these private forecasters and the IMF. And granted that some of the differences might arise from the fact that our sample is not somewhat significantly shorter than that of the IMF. We only have these 32 countries and up to represented up to 81% of world output. But nonetheless, the forecasts aggregated with the same IMF based weights as would the numbers for the IMF are an almost identical match. The story is different when we look at the short dashed line. That's the forecasts in April 13, and the long dashed lines, which would correspond to the forecast at a later date. We chose April 27th for this particular exercise. It's not that the shape of the recovery is significantly different. It's that the expectation about the severity of the contraction in 2020 is different. And the release of the World Economic Outlook forecast does not seem to have led to a significant downgrade of expectations. And for us, that's not to say that the IMF forecasts are not informative. To the contrary, they are very informative. What that actually tells us is that it is actually very interesting to explore these sorts of disagreements. Because at the end of the day, if policies are to be effective, if the policies that we envision are to be effective, we would think that they would inform and shape up the path of the recovery. And one of the things that we are interested as well in exploring deeper going forward is precisely to what extent these disagreements might reflect the fact that private forecasters or professional forecasters are more optimistic about the extent to which the fiscal and to some extent monetary support that has been provided might help cushion the impact in 2021. But nonetheless, the big lesson that we take from this is that, or that we want to take from this, is that it is interesting to consider what is it that is driving or that might influence the formation of expectations and the shifts that we see in the data. And that leads me to conclude, because as we've been arguing, or as I've been arguing as I presented some of the results that we have so far, at least part of these adjustments seem to relate to measures that directly or indirectly constrain business operations and the ability of labor to work as before the recession. But there might be more that is at play here, and I think I've talked a little bit about the idea that loss of human capital, the breakdown of matches between firms and workers, all of that could lead to a productivity slowdown that continues to weaken the recovery. But there might be other things at play that are also significant, like the fact that some behavioral changes may alter, at least over the medium term, working conditions and relationships, that the post-COVID-19 economy might require a reallocation of resources that might have to take place, and that is disruptive, and there are costs associated potentially with that. And that even with the support provided by policymakers in many countries to try to prop up the economy, the policy space in some dimensions can be a limited one. So as I said before, macro policies can play a role, and what we think our results show is that part of the story has to do with labor disruptions and all these factors that to a large extent you could consider as supply side factors. So part of the response, if it has to be credible and if it's going to shape up the private expectations and lead us to at least to expect a more benign recovery, might have to address some of those disruptions. And part of the ongoing debate that we are going to keep having, and that in institutions like the Federal Reserve, at which I work, we keep having, is precisely what types of measures we can develop that would indeed address these factors, as well as other of the forces that might be influencing the path of the recovery. And finally, very briefly, I want to just throw out there a thought on this. In some respects, a lot of the things that we talk about as potential features of the new economy were trends that were already pre-existing, like the increasing importance of e-learning, work from home arrangements, particularly online shopping and banking, fintech, and all of these innovations that have the potential to shape up the economic environment in significant ways that we not necessarily fully understand, to be fair. So I wonder to what extent the COVID-19 is going to ultimately be a catalyst for long-run changes in the economy along these dimensions, simply by accelerating some of those pre-existing trends, given that one of the things that most of them have in common is precisely the fact that it removes to a certain degree the need for one-on-one contact and the need for closeness. And with that, I'll stop, and I'll welcome your comments and thoughts and suggestions. Thank you so much.
Thank you, Enrique. Yeah, I will ask the panelists to turn on your camera. And I will start with a question first, since my panelists are still coming. One of my question is in your model, in particular, the one that you have a health outcome as a dependent variable. Because you have death rate there. And one of the issues is, I'm not sure how the model can capture well this, the death rate or the number of people that are dying, in the sense that this is kind of have a big lag effect, or we don't understand very well the lag, right? Because someone gets sick, then go to the hospital and then stay there, and then, you know. And I was wondering if you have thought about, or if the results change in terms of magnitude when you use, for example, a rolling window or a moving average in the model to kind of you know, see all the effects of the variables with a little bit of lag. Yeah.
Yes, no, that's a very good suggestion. And some of the, I mean, the short answer is that that's exactly one of the things that we are looking at now. Now we have a lot more data. The data is also have been revised and updated, so it's somewhat better than the one that we used. And we are able to also have enough of a time dimension to do exactly the exercise that you are talking about. Now, the preliminary results that we get are qualitatively not that different. I'll hold on just in case I have to reverse that after a full exploration of the data, but we still find that stringency seems to be among the variables that we are considering the one that matters for explaining the slowdown of this signal about the spread of the pandemic. We still find that it's only part of the explanation. In other words, there is still a great deal of across-country and within-country variation that cannot be explained with that regressor. So there is a lot of unfortunately noise in the signal that we have to contend with. But I think, as I said, the preliminary results don't seem to change that narrative all that much. Okay. With the caveat that they are still preliminary.
Thank you. Yep. Mala?
Yep. Enrique, thank you for that very interesting talk. I really enjoyed that. Now, it's just, my question is on the stringency versus mobility. Now, you looked at 32 countries. There are emerging countries and also developed countries. Are you able to tease out separate this group and see this stringency versus mobility, how it creates that expectations? Because my suspicion is that when you look at the developing countries, it's going to be different compared to the developed country. Because when you look at the IMF, the expectation is much lower, as you have shown on the graph. The expectations is dropping, the forecasters, compared to the forecasting that you have. Is it probably because of there's a lot more developing countries in the IMF database? So if you can tease out, will you be able to see that? That's one question. My second question is something on globalization, because we are talking about expectations. What do you think is the future of globalization after this pandemic? How is it going to play up in these expectations as well?
Yes, very good comments, both of them. Is one of the limitations that we have, even though it's actually quite unique to have access to 32 countries, is still not the level of detail that the IMF can provide. So we are missing a lot of emerging economies. That's one dimension where we are missing a great deal, and I think that does matter potentially. Now, lacking the data, it's hard to test that hypothesis. It's just my prior feeling. But I have to be frank, that's one of the dimensions in which we wish we had a bit more detail with which to dig deeper into questions like that. To some extent, we hope that the level of development can be treated as one of those initial conditions that get captured by the fixed effects, by the country fixed effects. But it's still it's an open question. If we had access to all those countries, it would be the same picture, or it would change somewhat. The other question in terms of globalization is I should say that I work for the Federal Reserve Bank of Dallas, but within the Federal Reserve Bank of Dallas for the Globalization Institute. So I think I have a vested interest in the topic as well as in the answer to your question. But the reality is, even prior to the COVID-19 recession or crisis, there were already signs. It's probably since the 2008 financial recession, that the degree of financial, trade, economic integration in terms of the freedom of movement and so on, was, if anything, receding, on the receding end. And there are things that makes us concerned that this trend might be one that accelerates. I'll cite two. One is policy related, and is the fact that, and again, it's not a novel phenomenon, but the COVID-19 seems to have given cover to politicians across the world to play the nationalist card. And one of the implications of that is potentially more restrictive policies, again, in terms of movement of people, information, trade, goods, finances, and so on. And the other thing is, one of the big unknowns to me is whether we are even going to go back to the world of last year, where travel was so easy. We would travel the world over and meet each other for conference. Think about us as an economist ourselves. We would be meeting in person in Australia right now. Now we are doing it here. And one of the things that we are learning is that this is actually an interesting and helpful way of reaching out to others in the profession and putting yourself out there. So maybe as a result of this crisis, one of the things that is going to change is that this movement is also going to that the way in which we interact is going to change, the same way that economists probably will do more of these things even after the COVID-19, once the COVID-19 seems to be under control. This is not to say that globalization is going to decrease because of this, but we are going to have to become aware that the dimensions of through which globalization matters are not exactly the same ones that we've been measuring so far. Maybe we need to pay more attention to the flow of information. This that we are doing now, for instance, could be construed as an international flow of information, where we are talking about economics, macroeconomics, and the pandemic across the entire world. So maybe we need to rethink how we think and feel about globalization, and that's sort of my more optimistic note on that.
Thank you.
Warwick, you have a question?
Yeah, I did. Thanks, Enrique. That was really interesting. This relates to Joaquin's question, because I was curious you used deaths rather than infection rates, because infections occur much more quickly. And also over the whole period, the treatments changed very dramatically, and treatments improved. There were new drugs coming in, not a vaccine, but treatment. So there were other variables between deaths and infections. And I wondered if you looked at infection rates, or is it just they're unreliable? So you can't really disguise death rates in different countries, but your reaction would be interesting. Thanks.
No, yes, no, that's a good point. I mean, Yes, there are so many complexities. It's even a challenge for epidemiologists themselves to figure out what the most sensible signal about the spread and the impact of the pandemic would be. As Joaquin was mentioning in his question, one of the things that is challenging about using numbers of deaths is that they come with a lag, and you don't know exactly when they come. The incubation period can be, at least according to the US CDC, between 3 or 4 days to 2 weeks, perhaps even more. And after that, you may die or you may survive. So it's an indicator that is that has a lag component that we don't understand fully. We don't have very precise data to know when that person was infected in order to do our analysis. And most importantly, it depends on things like, now we know it depends on things like the composition of your population. So if you are comparing a country like the UK and Spain, for instance, Spain is a lot older population than the UK, or significantly older, an older population than the UK. And that actually matters in explaining why the pandemic hit hard in Spain. So those things make it hard to extract a signal, a precise signal from death rates. Now, if you look at the other measures, and by the way, another important difference is, as you say, treatment has improved over time, and that also has a bearing on the mortality rate on the population. Not only that, in some of these countries, some of the mortality could be attributed not so much to the lack of treatment, but the lack of literally space in hospitals. Hospitals got overwhelmed at the beginning. So that also adds another layer of complexity. When we look, however, at, and we've done some work, and we probably will report on those in the on the revised version. When we look at positives, it's not without its challenges either, because different types of tests have different levels of accuracy. They have become better over time. Government policy was not the same at the beginning of the sample, where there were limited supplies and testing was restricted. Now it's more open in many countries to the population. So that also makes it complicated to extract a precise signal of the extent of the spread of the pandemic. So unfortunately, unless we can come up with a better indicator, we have to struggle with that data and recognize its limitations. And as you said, probably one way of being open about it is just look at different indicators of these signals about the spread of the pandemic in our analysis. Thank you.
We have a question coming in. Let me see if we can turn the camera. Okay, well, in the meantime, let me ask you a question. Now, I thought that there will be a very interesting application of your model, in the sense that, you know, there was a lot of discussion about how the protest and all this concentration of people actually is affecting, I mean, is increasing the number of COVID-19 cases, etc. And I think that your model, I mean, you already have all the variables that actually can control for it, and that's why you can test if this is this really, or quantify the you know, how this protest will affect the number of cases, and if this is true or is not, or what dimension. I don't know if you have thought about that yet.
No, actually, I have not thought about that. That as you know, the protests were not an isolated phenomenon. You saw protests in many other countries apart from the U.S. Because I'm assuming you're referring to those, and actually some interesting questions that we might be able to look at and investigate. Certainly would be a sensible thing to do, at least as an experiment, as a sort of say the natural experiment, because this explosion of protests happen, and one of the key recommendations from health officials is to try to keep social distance, to try to stay away 1.5 to 2 meters away from other people if possible, and keep other preventive measures. So these are these protests might offer as a way of testing if there is at least it's worth thinking if they can offer as a way of testing or teasing out whether those recommendations actually how effective they would have been using that the pre-protest and post-protest example as a way of quantifying it.
Yeah. Okay, thank you very much. We are wrapping up now. Then there is a question in the chat that you can, I ask you, Enrique, to answer then by typing. Well, I would like to thank you, all of you, and thanks Enrique for spending this hour with us. And our next event, which is on the screen, will be on a webinar by Anthony Goldblum, CEO and founder of Kaggle, the world's largest machine learning community, David Gruen, Australian statistician and agency head of the Australian Bureau of Statistics, and Tara Sinclair, associate professor at George Washington University and senior fellow of the Indeed Hiring Lab. And they will present on data science, and COVID-19. Thank you very much, everyone. And for more information on CAMA, the COVID-19 and the macroeconomic program, our upcoming events, academic research, and other publications on the topic of COVID-19 and the economy, please see our website. And thank you, a special thanks to Enrique. It was great to have you here. Thank you.
Thank you, Joaquin, and thank you, everybody, for having me. Thank you.